So Practice Fusion is a free web-based electronic medical record system. It is designed for ambulatory practices. It is a particularly useful tool for small primary care practices. Because it's web-based, all of the support needs for servers and backup and all of that stuff that is needed for most enterprise systems is not an issue with the web. All you need is an internet-connected computer. And that removes one of the large technology barriers for small practices. Free helps. It's subsidized by ads. We do have an option to subscribe and turn off the ads. Virtually nobody uses that, but it's an offer. I think maybe a half a dozen people have actually opted for that option. Whereas our user enrollment has been growing by leaps and bounds. We've got over 70,000 users, over 8 million patient records, adding about 77,000 patient records a week. So it's really taking off. About 1.5 million chart notes created in January. So it's a year ago I would have thought those numbers astounding. They are astounding.
They are.
Free is a big deal. as one of our slogans is free changes everything. It does. Again, it doesn't intend to be or try to be a hospital-based system. It's not. It's an ambulatory system. It is, like I said, particularly useful for small practices. It has the two biggest barriers to adoption of electronic health records are cost and usability. Usability translates into a decrease in productivity for a certain period of time. If it's clunky, if it's a difficult learning curve, there'll be typically as much as a 50% decrease in productivity that can last for months. That's not been the experience with most of our users.
What makes yours more usable?
We pay meticulous attention to the user interface. So again, it's web-based. It's not kind of a clunky form-oriented user interface or UI. It's very user-friendly. We continuously improve it. We have a roadmap of things that we intend to build into the system. But one of the feeds of what makes that roadmap are feedback from users. So kind of request a feature, there's a little request a feature button on the application. And we incorporate those things. And where we see that there are issues with adoption, then we fix those to improve the adoption. With an ad-supported revenue model, it's important for us for users to become what we call power users. Because we don't have anything to sell, we sort of give away the front end for free. It makes no difference if you just sign up and do nothing. So when somebody does sign up, we want to make sure that they can rapidly adopt the system. We have people that outreach to the users who have signed up, look at ways of how can we help them get to be what we call power users. And if there are obstacles, what are they? And if they're learning obstacles, then we address those. If they're product feature obstacles, then we incorporate that into our roadmap of development.
So you offer training?
We offer training for free online, not on site but online. There are embedded YouTube videos throughout the application, which means you need enough bandwidth to run a YouTube video. So
But it's only running on the iPad anyway, right?
it's running. It doesn't run on an iPad. We just introduced a wrapper that allows it to run on the iPad. It runs on every other platform. Runs on Mac Air just fine. Runs on all the Macs. It has to do with the fact that the user interface is built in Flash, and iPad doesn't support Flash. That's sort of the issue there. That's a little bit beyond our control, but it runs on everything else. Actually, Mac Air comes with a keyboard, so it's just about as light.
Right.
But it runs on any platform, any browser, and all that a physician needs is an internet-connected computer.